When was the last time you actually had a proper exam? You sat down, had the doctor's attention, and it lasted more than, 10 or 15 minutes. In this next short video, I'm going to explain what a proper exam is, what to expect, what to look for to know that if you're getting one, possibly even some questions to ask your clinician. Hi, I'm Dr. Krugly. I'm a board-certified chiropractic sports physician, and I'm a diplomate with the American Chiropractic Board of Sports Physicians. That's a credential less than 1% of my profession holds. In my years of practice, I see it repeatedly. Patients come in, they've had a problem for years or a lifetime, and they've been through treatment, they've seen physical therapists, they've seen chiropractors, orthopedists, and they've had the problem area looked at, but no one's actually done a thorough exam. No one's actually given them a true diagnosis. In my opinion, that's why a lot of the times when patients have been failed by previous providers, this is why. When practice is dictated by numbers, insurance will only allow a doctor so much time with their patient. Because of that, oftentimes, doctors don't have the time to sit down and truly dig, find the root cause of their problem. This is not a slam on the professionals that you might have seen in the past. This is a problem with the system. This is what happens, unfortunately, when, again, healthcare is run by numbers and not by the patient. So what are the components? What are the components of a true exam? First, we start off with taking vitals. And we do that to rule out what we call red flags. Red flags would be either a condition that warrants immediate attention, or a condition that maybe needs to be seen by another professional. We start off with vitals, and that is blood pressure, respirations, pulse rate, oxygen saturation, temperature. These are all important things when presenting at an office with pain or any concern, because if the patient warrants immediate attention in the emergent setting, vitals will allow us to know that. After we have vitals, the next component of a thorough exam is a history. I was told in chiropractic school by my professors that if you know what questions to ask, the patient knows their diagnosis. We just have to know how to pull that information out of them. A competent history is going to include basics like, when did the problem start? How did the problem start? What makes it better? What makes it worse? Ergonomics, work situations, life situations, sleeping patterns, nutritional habits, family history, other medical conditions, medications, supplements. Those are all basics. Then, depending on a specific condition, the history can get even more specific. So let's say I'm working with a patient who has fertility issues. Then we're going to ask questions like last menstrual cycle. When did menses start? At what age? Do you have PCOS or endometriosis? Let's say that this is a head trauma case. Have you experienced signs of or symptoms of dizziness, headaches, disorientation, memory loss, sensitivity to light or sound, changes in bowel or bladder? So a competent history should take the physician 10, 15, 20 minutes and really span from the beginning of your story up until the point that you're in their office, following the history. Once a history and vitals have been taken, then we're going to move on to sensory, motor, and reflexes. What we're doing at this part of the exam is setting a baseline so we can test our future progress. So I know that if you started with absent reflexes or deficient sensory, and over the course of care, some of those things have improved, we know that we're making progress. This also helps to start isolate whether the problem we're dealing with is more mechanical in nature, more neurological in nature, or organic. Organic meaning organ system. A common complaint that gets missed, I think, by a lot of providers is females who present with low back pain, especially postmenopausal. A lot of the times there's a chronic UTI at root of this back pain. And unless you know what to look for or have had a competent exam, those things can get lost or glossed over. Once we've collected the reflexes, sensory, and motor, now we're going to move into inspection and palpation. The point of inspection and palpation is to be able to isolate where the problem is coming from. Again, I'm trying to, a good clinician is going to, try and isolate what part of the body the pain is generated from, and can we reproduce that through mechanical stress, and if we can, it's likely an orthopedic or neurological problem, or is this, again, an organic issue? Another example would be patient has pain in between their shoulder blades, and their orthopedic and neurological tests come back and they're negative, meaning they don't show anything. However, the patient also has pain in the lower right quadrant. This is the area that the gallbladder can become inflamed, and if it's pressed on, is often painful. So if that patient with the pain in between the shoulder blades has that as well, I'm thinking this is more of an organic issue than an upper back issue. Once inspection and palpation is completed, we move on to orthopedic tests. Orthopedic tests are meant to stress the tissues that are injured. Orthopedic tests allow us to decipher, is that shoulder pain from a rotator cuff tear, a biceps tendinosis, an AC joint sprain, a labrum injury. With proper orthopedic testing, we can differentiate between the structures that are injured and the structures that are not. So that if imaging is required, we know exactly what to let the radiologist know to look for. Imaging and lab work should always be done to confirm a diagnosis, not to fish one out. A functional movement assessment, by definition, looks at the global movement of the patient. We perform functional movement assessments to gain insight into how the body is moving as a whole, and also to create a baseline, again, to test our interventions off of to make sure we're progressing. Functional movement assessments can include things like squats, deadlifts, lunges, and presses, walking, depending on age and the condition of the patient. Standing up or sitting down might be the functional movement assessment. What this does is allow us to take some of those earlier findings from the orthopedic and neurological testing, DTRs, the deep tendon reflexes, sensory and motor, and take those isolated findings and apply them to the system as a whole. What's the importance of us going through this detailed examination? How long does a detailed examination actually take? In my office, it's anywhere from an hour for a non-complicated case. In cases of motor vehicle collision or significant trauma, the exam can last 2 days, 2 hours each day. So what's the importance of this? This gives us a baseline to test our intervention and make sure that we're moving in the right direction. If we are, we continue with care. If we are not, we reassess. Did we miss something? Or do we also need to have other eyes on your case? A thorough exam is, in my opinion, missing in most of healthcare today. A thorough exam leads to a diagnosis. A diagnosis guides care. That is one of the most important things we can do for our patients. It's one of the most important things that I do, and I'd love to be able to perform that for you. Please feel free to comment in the comment sections if you have any questions or if you'd like to share your experience with a real or a faulty exam. Subscribe to the channel. We go into detail like this every week. And if you'd like, call the office and book a consult, and we can dive directly into your actual concerns.